Welcome everybody. This is the last of the two webinars in our series. My name is Pat Cleave and I work for the VFF. Just to start with, I'd like to thank our sponsors today, which is the Victorian Farmers Federation and Agriculture Victoria, who are sponsoring this project through the Enhancing Biosecurity and Animal Welfare Project, which has been delivered by the VFF. I'm going to introduce tonight, and our main speaker is Dr. Andrew Whale of Livestock Logic. So remember, Andrew's going to speak for about 40 minutes and then we're going to have opportunities to answer questions. So if you want a question that pops into your head, press the blue hand flag there and enter it, and we'll get to those questions at the end. I'm now going to introduce Andrew and get started. So Andrew was born and raised in a small country town in southern New South Wales, and he's close to there at the moment. He's always had a strong interest in livestock and started breeding white Suffolks in 1995. Andrew, as a vet, so he studied at the Charles University in Wagga, and after graduating worked in Tallangatta for a year before moving to Hamilton and joining Livestock Logic. Andrew's desire to have a whole flock focus has brought him there, and he enjoys being involved in farm decisions, working one-on-one with clients in Victoria and southern New South Wales. He runs another of lifetime ewe management groups and best lamb groups, and I think Andrew is one of the more practical large animal vets in this part of the world, and certainly I always use him as a sounding post for anything that's new, which I'm not certain about, and I think he's got a very good, sharp bullshit meter. So I'm going to hand over to Andrew now, and to deliver the next part of the talk. Andrew?
Thanks, Pat. And thanks everyone for joining us tonight. I guess what I'm wanting to deliver to you all tonight is just to give you a clear understanding of what is the best option for your sheep or beef operation in regards to providing pain relief for sheep or beef at either marking or the dehorning situation for beef guys as well. Lexi Leonard, one of our vets at work, has helped me prepare this, so I was just acknowledging her in preparing the slides we've got for you tonight. So I guess one of the reasons we're here tonight is that pain relief for mulesing is now a requirement as of last week in Victoria. So this means we must use some form of pain relief when we're mulesing animals. It's not a requirement to do it always at marking, but it's still a suggested thing to do from our sheep welfare standards to still use pain relief when marking. But as I said before, it's now a requirement for mulesing of sheep in Victoria. To draw your attention to it, they are quite simply that a person must not tail dock sheep that are more than 6 months old without using any pain relief. So that's something that if you are doing lambs older than 6 months, you do need pain relief. Person must leave a dock tail stump of a sheep with at least one palpable free joint remaining, and I think that's something that I'd draw to most people's attention, that there's a lot of tails that are being cut too short, and there's one from the welfare standards, but also from reducing the amount of vaginal prolapses we see in sheep. We should really be letting that tail go to the tip of the vulva, and I think as lamb marking approaches, it's a really good time to remind people. And as a vet, we get a lot of phone calls about sheep with vaginal prolapses, and the most common thing we see is that their tails have been cut too short. So we're actually causing that from lamb marking, and at $400 for a crossbred ewe at the moment, we don't want to be losing 1 to 2% of them due to vaginal prolapses that could have been prevented through better lamb marking technique. Again, we can't castrate sheep more than 6 months of age. Sorry. And there's a suggestion there that tail docking and castration should be accompanied by pain relief when practical and cost-effective methods become available, which I guess is what we are here to discuss tonight. So the first thing I want to get really clear is that we essentially have two different classes of drugs that are available to us, and I will talk you through these, but I just want to make sure that people are understanding the difference between these drugs. So we've got trisulfan and Numbnuts that are both local anaesthetics. So they offer very good pain relief to a certain area of the body, but it's short-lived pain relief. And then we have our systemic anti-inflammatories, which are buckalgesic and Metacam, and they both contain the same active ingredient. And I just want to make it quite clear here that these cannot be and should not be administered together. Because they're the same active, we are more likely to cause a toxicity, and not so much a toxicity of that product, but we can cause kidney and liver damage by overdosing, and there's absolutely no reason that we should be combining the two products together. So that's for the anti-inflammatories. There's lots of reasons to combine one local anaesthetic with one systemic anti-inflammatory. So the gold standard would be to use one of each of those products. So a local anaesthetic to provide really good short-term pain relief, and a systemic anti-inflammatory, which is similar to a Nurofen that we might take, to give them pain relief for after the 4 to 6 hours when the local anaesthetic is worn off, to give them pain relief for the coming days. I would say that there are times that with certain applications that one of these products may well be sufficient due to there not being significant pain in the days post operation, and I will take you through those. So the first product I want to touch on is Numbnuts. So yeah, Numbnuts is the drug we use. Numbnuts is sort of the brand, and I probably should have had an image up of the applicator that's been developed over in the UK, and I think this is a great breakthrough for whenever we are using rings in animals. So it provides virtually immediate pain relief that lasts for about 45 minutes, which is when lambs experience that really nasty pain that's associated through loss of blood flow and essentially killing of those nerves when we put on a ring either on the scrotum or on the tail. So this product is only for that use of castration or tail docking, and it's an S4 product, which means it must be prescribed by a veterinarian. And just to give you an idea of the cost, it's 67 cents per dose, and obviously males need two doses. So just some pros that we see with this product. It's relatively easy to use. It's the only pain relief that we feel is significant, that does a significant enough job to help counteract the ring application, whether that's on a scrotum or on a tail, and it's instant pain relief, and there's clear visual results when using this product. Some of the cons, it's a bit of a cost for the outlay of equipment, particularly for smaller farmers. There's a moderate price per dose, and there's some. Well, I'd say it's actually probably almost a pro, but it's a pretty brief training exercise to know how to use it. There's no meat withhold on or an ESI on that product. Trisulfan. I don't think this needs a huge introduction because it's been around for a long time, but I guess what I really want to make clear about trisulfan, like Numbnuts, is it gives us short-term pain relief. It's wonderfully effective pain relief, but it really only lasts for that first 4 to 6 hours after application. Also an antiseptic agent, which helps keep the wound clean. Now, it's of absolutely no use if we're applying a ring, and that's because it needs to be absorbed through an open wound. So just make that clear. This is a wonderful product for mulesing. It's also a good product for surgical castration and surgical tail removal. But there is no, and this is something that's becoming of use quite a bit recently, there's a lack of evidence to suggest that it's a highly effective product when we use a gas knife. And that's because of the burn that we cause on that wound. There's not the evidence that that's effectively absorbed to help with the pain relief in that animal. A big advantage of this is it's an OTC, so over the counter. There's no need to engage with a vet to have this product on your farm. And the price there is $1.50 for the mulesing wound. If we're going to apply it to the castration or the tail docking, that would be extra volume and a further cost. Again, it's I guess it's very easy to apply. Relatively easy to waste doses, and some people use it and put it on fairly liberally, whereas some of the other products are, the rest of them are sort of a set dose and hard to overuse. There's still considerable pain experienced more than 6 hours after mulesing, and I think that's something that probably a lot of farmers do see in the following day if you are looking at lambs, and 2 days later, and that's probably where the Medicam and the buccal really come into their own to help with that pain relief. But while we're in the yards doing lamb marking, this is the product that we see a massive response from in mules lambs. So I guess the final point there, ideally a second product is used to provide us with that pain relief in the days following surgical mulesing. So the next two products are the two that are essentially the same active ingredient, just a very different mode of delivery. So the first product is Metacam 20, as you can see there. So it's a systemic product, and so I guess one of the benefits of this is that we're giving it to the animal. It's in the bloodstream, and regardless of where they're experiencing pain, that pain is reduced in the animal due to it being a systemic product. It's a subcut injection. Now, the other thing that's really important with both of these products is they are not active immediately. So there's a minimum of sort of 15 to 20 minutes before we get absorption of these products into the bloodstream and before we start to see the benefits from them. And look, once again, I'd liken it to taking a Nurofen. It's not an instant feeling, but 30 minutes later, you can actually start to feel some benefits from taking that if you're in pain. It can still be given in the cradle, but yeah, as I said before, it is not on board at that time in terms of the effects in the animal. It's an S4 product, so again, we need a relationship with a vet. The price, the gum there is relatively cheap, and most of the time it's actually free with product. And Meloxicam, the price for a 15 kilo animal is about 70 cents per dose. So easy to apply, and one application covers all three procedures, all surgical procedures, and we get sort of up to 3 days pain relief. Now, visually in the lamb marking cradle, there's not and immediately in the yards we don't see a huge benefit in this product, but I've got some data later that I can show you in the hours post and in the days post. There is some clear benefits from using Medicam. And buccal is, as I said before, it's the same active ingredient. The difference being that we put it in the side of the mouth, in the buccal cavity. Again, it takes time to be absorbed. We also need a relationship with a vet. It's an S4 product, but it lasts for a similar amount of time to Medicam. There's probably not quite the level of information out there and data out there on how long this stays at therapeutic levels in comparison to Metacam 20, and I can show you a slide that shows that in a minute. And it's I should have said at the start, but these are the prices that we have in our clinic. But we price it. It's the same price as Medicam for animals for a 15 kilo animal. Again, easy to apply. One application covers all three surgical procedures. We get 3 days, so you can see it's very, very similar to the Metacam 20. I find that different producers have a very different. Some of these products. They have a clear choice that whether they prefer buccal or Metacam 20. And and it's probably depending on how much they like giving needles versus drenching. You're going to have the same conversation with two different farmers, and one will just be black and white that the buccal they're preferred, and others like the Medicam. And look, I don't buy into it. I find giving injections easier than doing the buccal but that's just my preference. So everyone's got their own choice. One thing you need to be mindful of with buccal is it is a very thick product, and my advice to people is that you have two guns and two products ready to go, and you keep one in a warmer place, because if it's a cold frosty morning, you'll have trouble drawing up the thick buccal, and it's definitely been a common issue that some producers have had. So again, you won't see the instant benefits from this, but there is some good evidence that shows improved or a reduction in pain responses in lambs post-administration with buccal, particularly with the mulesing operation. So just thought I'd just show you, just give you a bit of an idea of how long these products last in the animal. So we can see here the Medicam, the M20, on the right-hand side of your slide. That's got the half-life, and that tells us how quickly the product breaks down. And you can see there's some other anti-inflammatories here that we don't really sell for pain relief, but you can see how the half-life of Medicam is much longer than those, and that's why we're not big on getting these other products into animals for pain relief, because they just don't last as long in the animal. So I'm not going to talk in detail about that, but that's just to show you that there is good data to suggest that these products do maintain therapeutic levels for pain relief in animals for a significantly longer time than some of the pain relief options that have been around for up for 10 and 20 years. I just want to talk you through probably I'd say the best bit of pain relief research that's been done by Alison Small of CSIRO, and I think AWI were, I presume they paid for the work to be done. So I'll just talk you through it. There's essentially 6 different treatment groups here. So one was the sham, which means they didn't have a treatment, but they were put in a lamb marking cradle and went through the experience of lamb marking without being actually mulesed. We have animals that were just mulesed, and that's the red line. So mulesed traditionally. We had the mules plus the buccal, which is the purple line. We had the mulesed and the trisulfan, which is the dark yellow, sort of brown, the brown colour. And then we had the mulesing that got a placebo and a trisulfan. So and the final one, which is the orange, was the mulesing with the buccal and the trisulfan. So what I want to show you here is that the group that got the brown, the orange and the purple, you can see quite clearly had much better pain responses, and they both had the buccal on board at the 4 to 6 hour period after the mulesing operation. They had the most significant benefits in terms of grazing time. So the percentage of those animals grazing was not, well, in one group it was equal to the sham, and in the other group it was 23% as opposed to 30%. So a clear improvement 4 to 6 hours after compared to all the other treatment groups, which did not have the longer term pain relief. What you can see is at 0 to 2 hours, so that first 2 hours on the far left and the data points, the groups that had the trisulfan on board had very good responses to a very good reduction in pain relief. So I guess this is why I think this is great, is that it clearly shows trisulfan is the drug of choice for the first 2 hours post mulesing, but the meloxicams, being buckalgesic and this work was buckalgesic, but we expect Metacam to behave exactly the same. And the next slide actually is a Metacam trial, shows how good they are in that 4 hours plus. So we really do need a different product for the two different pain experiences that those animals have, if we are going to provide good pain relief for early and later pain that's experienced with mulesing. So this is trial work that we did on Medicam, and it was a paid trial by Boehringer, but it was a completely blinded trial. I actually did all the administering of the drugs, and we had 2 vets turn up that monitored them for the next week to see what improvements we had in pain. So again, we had a group of animals on the no met, so they were mulesed, surgically castrated, and tail docked without any Medicam. We had a Medicam group, so they were mulesed, castrated, and tail docked, but provided with Medicam, which was delivered more than 15 minutes prior to the surgery. And we had a sham, so again they were picked up, put in the cradles, but no marking was done. And what this shows is the proportion of normal walking behaviours in these animals. So the sham were at 80% of the time when they were walking. It was perceived to be normal, and we had about 70% in the Medicam group, compared to only 30% in the group that had no Medicam. So there was a pretty clear benefit of using Medicam to reduce our pain response in those animals. We also, in this trial, measured weight gain response, because I think it's a really common question we get from producers: will we see a weight gain benefit? And I can tell you with a fair bit of confidence that no, you won't. And in my opinion, we probably never will with the products we have available. There's still some pain in these animals, and I guess we're not. There's been lots of trials in trisulfan over the years, buckalgesic and Medicam, that have all wanted to show a weight gain response, because obviously it is an easier sell if we can make some money back. But my opinion and the data to this point is in agreement that there's no financial gain in terms of, there's no weight gain in animals from providing pain relief to the techniques of mulesing and castration that we are currently using. And I think that's a really important thing for people to understand, that they're not going to see lambs finishing sooner just because they're providing pain relief. So I guess I'll sort of finish up on the sheep side of it with just giving you our veterinary opinion on what product is most appropriate for the most common methods of lamb marking that we see. So for clients that are just using a ring on the tail and a ring on the scrotum, we believe Numbnuts is the best approach, and that's because there's a very serious but short-term pain response that's associated with putting on a ring, and Numbnuts helps you get over that pain response. So when we've done trial work before I'll leave it at that. When we do not use any pain relief, all lambs show pretty significant pain response from about 10 minutes after a ring is applied to about 30 minutes. And after that time, we find that they're up and looking for mum after about 30 minutes. And that Numbnuts is absolutely wonderful for providing a local block to that region that's experiencing the pain for that period of time. And so we believe that is the drug of choice. If we're putting a ring on scrotum and we're surgically removing the tail, then our advice would be to use Numbnuts on the scrotum and to use a systemic anti-inflammatory to help with the pain associated post-surgery from the tail removal. With the surgical tail removal and surgical testicle removal, then we would be recommending a systemic anti-inflammatory with trisulfan to apply onto that wound to really improve the pain response at the site of the surgery. And for mulesing, trisulfan is still our drug of choice to get them through that immediate pain, but we would love to combine it with a Medicam or a buccal for the longer term benefits that I showed you in that trial work. So the other area of what we want to discuss tonight is calf marking, castration, and dehorning. Now, it's a pretty because I've explained to you how these products are used. It's actually it's all very, very similar, and essentially when we've got a wound, trisulfan is our treatment of choice for the immediate short-term pain relief, but buccal and Medicam are our preferred options for that longer-term pain. So again, if we are using a ring, what we don't have at the moment is the Numbnuts option. There's the potential for that to be developed later on. So we don't, but at the moment, and there are people playing around with the gun, and we've had a few clients that are keen to give it a go. At the moment, the gun, the way it's set up, it's sort of it probably needs to be reworked because you're holding it. The calf is not generally lying down in the same position facing you when you're applying a ring, that it is. Obviously, calves are standing up. Most of the time when we're marking calves, they're standing up. So you need the bottle up the other way for the product to be drawn back up into the bottle. So Medicam, I guess, and buccal again, I just want to draw to your attention, they're systemic products. If we're doing multiple painful operations, then this is going to then the same dose is going to tick off both of these. So the castration and dehorning we're going to get some pain relief from both of these products. From this product for both procedures that are being given. I guess again the problem with this is to get that pain relief on board, we really need to be giving it 15 minutes prior, and that's where the trisulfan comes in handy, in that we can immediately apply it to the castration wound or the disc budding or dehorning to get that immediate pain relief. The over-the-counter and S4 issues are no different in cattle. Trisulfan is over-the-counter and can be purchased at a retail store. There is a requirement for a veterinary relationship to get a hold of the S4 products. So much like sheep, I think it summarised it down the bottom. Trisulfan provides wonderful short-term pain relief, but for the 12 to 72 hours afterwards, it's our anti-inflammatories that are required in combination with that trisulfan to give us good pain relief. As I said before, the Numbnuts is currently not registered for use in cattle, but we know it's being trialled and they're really happy with the effects, but they're still trying to work out what the dose needs to be and the location, because there's a little bit more separation between the spermatic cords in cattle. There's a bit of an uncertainty as to whether one dose is going to be sufficient and what that dose needs to be, and the design of the gun needs to be sort of worked on before it's sort of fit for use and fit for retail. But I do think it's something that could well come into play for ring, utilising rings with cattle. So I think that's all I had in the presentation, Pat. So we can probably move into some questions.
Thanks, Andrew. Hey, there's a few questions that came up, and I'd probably like to ask you the first one, and I think it was from Kate Bishop, and Kate's asking about goats, and the question is, can this be used on goats? And I think she was referring to the Numbnuts. Andrew, would you like to answer that question? Okay, well, certainly what I'll say is that we're going to try and put together a goat-specific webinar probably in the next couple of months for this specific area, because a lot of cattle and cattle and sheep producers don't realise that goats, being a minor species, have very little products that are registered for them, and certainly lignocaine is one of those products, or pneumocaine is one of those products that can't be registered. Andrew?
Yeah, sorry. I'll answer the question. Your line's not great. So yes, it definitely can be used in goats. The dose.
Sorry.
You're not overly clear, Pat. But so Kate, yes, definitely can be used on goats. I am just trying to remember so they're far more likely to have a toxicity. So the dose, you need to be careful with the dose, and that's something I actually cannot remember off the top of my head what the goat dose is, but it's not the same. So I can chase that up for you somehow, Kate. If you want to ask another question with your email or something, I can get that answer for you. And I'm sorry I don't know that. I remember reading about it 12 months ago when it first came out, but haven't actually dispensed it for goats since. So yeah, please put your email on there or phone number, and I'll chase that up for you.
All right. I'm not sure if mine's working so well. Andrew, can you take the questions?
You're good.
Is that working okay? Okay. All right. Another question from John, and John's a mulesing contractor by the looks of this question. He's saying, what if we go onto a property as a mulesing contractor and the owner is not supplying any pain relief for those animals, in Victoria, I assume? What should we do? Andrew, do you want to answer that, or I can answer that? What's your opinion?
Yeah, no, happy to. So you can't. You can't just do it. So there's a requirement there for pain relief to be required. That's a really good question. Not something that I'd really thought of, but I guess I think what you need to do is have trisulfan. Like, you've got to make two decisions. Are you going to do it, or are you going to leave the place and say, look, you need to be more organised? But essentially, I guess the way to get around it is you have trisulfan on hand, and you can treat the animals with trisulfan, and you can unbill that to the client, and that way you're able to keep your job functioning, and you're doing everything appropriately. So it's the only product you can have in your car, because you can't have, as a contractor and not the owner, you can't be holding on to the other drugs ready to use at your convenience. So I guess it's probably a handy thing about having trisulfan OTC, and that can allow you to get over that. And then hopefully next year you'll be more organised.
Yep. Here's a question from Melina Tenson, and Melina's asking, is Medicam in similar action to Nurofen? Then why does it last longer than 8 hours, i.e. a number of days you have observed? Andrew, you want to ask her of course, we've got to remind people that you can't use Nurofen in livestock, but the question is, why does Nurofen only last 8 hours in humans, and why does Medicam last so much longer? Andrew?
So, look, I'm not a pharmacologist, and I have no idea on how Nurofen works in humans. All I can say is there's good trial work to show, and I guess it relates to the difference in half-lives. Like, if we went back to those slides, some of those other products are anti-inflammatories, the same as Nurofen is, but they're not giving as longer effect. And I guess it comes down to the half-life and how long it takes to break down with the animal. So clearly there's a longer half-life in Medicam, or Meloxicam is the active, in animals compared to there is for Nurofen in humans, I guess, but I can't comment on Nurofen, I'm sorry.
Yep. I suppose that, I think you're absolutely right. It's to do with how long the drug lasts, and certainly they're both non-steroidal anti-inflammatories, and there's a whole range of those ones, and some of them are longer acting than others, but certainly that's the reason. And certainly Medicam is available in humans. It's a once-a-day application too for arthritis and stuff like that. It's not called Metacam, but it's called Meloxicam itself. The active is used in humans as well. There's a question from Kerry DeGaris. Kerry asks, when to apply the Medicam timing? Before putting lambs in the cradle, which I think is a bit difficult, should rely on the trisulfan and apply the Medicam in the cradle, and this will kick in once the lambs are off the cradle. So, Andrew, what do you think about timing of the use of Medicam, and when should you apply it ideally?
So, without a doubt, we should be doing it 15 to 20 minutes prior to the operation that we're doing to get its maximum benefit. But I love the idea of using what you have said. Should we rely on the trisulfan and apply the Medicam in the cradle, because that allows us to get immediate pain relief with the trisulfan, obviously numbing, and I'm not sure what you're doing, but numbing the mulesing wound, and then we've got the Medicam on board to, as that trisulfan wears off, 4 to 6 hours later to help with them in that sort of mothering up process and going back onto pasture with mum to reduce the likelihood of them being mismothered, but I guess fundamentally to make them more comfortable in those 2 days post surgery.
All right, and
there's a good question up that I think is a great question from Stephen. Sorry. So am I recommending a ring on the tail rather than a hot knife? No, I'm not, Stephen. I think it's a really good question, and I think the reality is we don't have sufficient evidence on what is the worst or the least pain between those procedures, and I think it's something where we really need to look at what are all the different treatments we can do with the best pain relief options and what gives the best result for the animal. I think about the public perception of a ring being applied versus a hot knife, and I think the ring is probably an easier sell to the public. Personally, I think a ring without pain relief versus a hot knife, I think the hot knife is probably less painful for an animal rather than having a slow blood circulation being stopped to an area of your body without pain relief or without local anaesthetic. That you see the pain that it is in an animal with a ring without Numbnuts, and it's significant. So I know one looks a lot better than the other because we probably don't associate a ring causing a lot of blood and it's not gory. But no, look, I guess to cut to it, I'm not recommending one or the other because we don't have the data to say that one's a lot better than the other. What I am recommending is when we're putting a ring on that we really consider using Numbnuts, and if we're doing a hot knife that we consider using a product like buccal called Medicam to deal with the post-surgery pain that we get with that treatment.
All right, Andrew. What about castration? And what have you got an opinion on castration of surgical castration or rings?
No, not really. Like I guess similar. It's a similar question, I think, in that just cutting out testicles as opposed to applying a ring and giving pain relief for that. One's an easier sell because it looks better, and if we can give good local anaesthetic while we put that ring on, I think it's a really sound solution. It's a clean solution, and so for that reason, that's my preference for what producers are doing. Yeah, is let's use the ring because it seems to be the mode of choice for most people now. But let's use the Numbnuts to give us good pain relief.
Okay, all right. Andrew, I've got a question for you, and it's more a question about you're a veterinarian. You are sometimes asked to prescribe these drugs, so prescription drugs. when are you allowed as a veterinarian in Victoria to prescribe a product like Medicam to a producer?
So, yeah, good question. It's so there's a sort of a checklist that we need to go through, and the first of that is that we need to be the person needs to be a bona fide client of ours, and for that to be the case or for them to be our client, we need to. One thing we must have had is at some stage physical contact with that animal, and we must have an understanding of the way those animals are managed. So that's the first thing that I think probably gets a lot of vets off the nose with the public, is that we have a legal requirement to know that. So even though we might be really comfortable with the person, if we haven't had physical contact with the animal, there's absolutely nothing we can do legally to provide any prescription medication. I guess that's much the same way that a doctor's not going to write out a script for you to go to the pharmacist without actually meeting you and making sure you've got a problem that needs dealing with. So that's the first thing. The second thing is that we need to establish therapeutic need, and I think this is a really important part of it. And I guess my view is that once I've got a relationship with a client and I know that they have sheep, for example, and I know that they're mulesing, then it's quite easy for me on an annual basis to know that they need pain management and that there's a therapeutic need for that pain management in those sheep for as long as they're mulesing. Now, I still need to have some sort of a relationship with that person and be comfortable that they're still running sheep, and that's where I guess if the only time a vet sees you is that one day in September before you mark your lambs, that they might request for a bit more information to be really comfortable that that's being used appropriately, and that's at the vet's discretion. Our view, or my view, is it's a lot easier to get pain relief and RAM sedative, things that have an annual requirement, and the situation's not changing on that farm on a regular basis for those products to be administered. Whereas antibiotics, I'm less likely to just dispense those on an annual basis, because if you're requiring antibiotics, we need to establish, well, what is that being used for? So what's wrong with your animals? Why are they always needing antibiotics? Why have you always got foot abscess? Is it foot rot? What are we actually dealing with, and how can we help you manage those sheep or cattle better? Whereas pain relief, RAM sedative, there's sort of an always need for that on many farms, in my opinion. So I just want to make that clear, that it's the therapeutic need is what we need to establish, and different clinics do have a different rule in that, and that's as a veterinary practitioner, I guess that is their right to come up with what they are comfortable with to establish that therapeutic need. Is there any part of that I should have, that you think I should clarify? Or?
Yeah, no, I think that's covered it pretty well, Andrew. Hey, Andrew, there's a question from a guy called Terry here. So let me just find where.
Terry Sim.
Yeah. So Terry's asking, Andrew, does your answer to the John, the contractor, mean that for best practice pain relief to be applied, i.e. trisulfan plus Medicam or buccal GC, producers must be organised to supply a systemic anti-inflammatory?
Sorry, I was reading another question.
So Terry, so your original question about having trisulfan on hand, and Terry's saying that should a producer have to supply systemic anti-inflammatory as well as trisulfan for mulesing, that is.
Sorry, I was just trying to find it. Yep. Does your answer to John, the contract man, that the best practice to be applied? Correct. Yep. Yeah. So trisulfan you can go and get off the shelf, and you can, that'll take you 1 or 2 minutes presumably. Medicam, buccal GC, your vet needs to be happy to dispense that. Now we as vets, we do dispense this, but you can't just walk into our vet clinic and grab it, because it actually needs to be approved by a veterinarian. And if we're out for the day, preg testing, doing whatever we're doing, we actually need to have written up label for you to have that. So it really is a case where you need to get on the phone, a few days out and make sure that that's all going to be fine, and that there's no other requirements that the vet clinic. And I'd look, if you're some distance from a vet clinic, do it weeks out. Do it when lambing starts. Give yourself 6 weeks for them to make sure that they've ticked their boxes.
All right, I've got one more question here. I've got another question. Justin Tui is asking, Andrew, in your practice, are you observing an increase in pain relief uptake by producers of sheep and or cattle? And any thoughts on current levels? So, got a feeling for that, Andrew?
No, look, definitely we're seeing a lot more. It's really hard to know. There's a lot of vets where we are, and there's a lot of people that might use our clinic for some things, but not use them for others. So it's really hard to know what percentage of them are. We can't say they're not using it just because we know them and they haven't come in and got product from us. But there's a huge increase in the use of all products. It'll be an interesting thing to look at from a percentage point of view on how much it's changed. But because trisulfan used to be all through vets and now it's over the counter, where obviously there's a lot of it that we're not having anything to deal with. So I was thinking I could actually give you a really good answer, but because of the trisulfan, we'd probably only keep 2 or 3% of the sales of that for our region, as opposed to probably 50 or 60% 5 or 6 years ago. So, but there's a hell of a lot more people using buccal Medicam, and in particular, Numbnuts is the one that's probably been the big growth for us in the last 12 months. Obviously, it was a brand new product this time last year, but we would have already sold 5 times more what we sold last year. Would be actually, I do know that's very accurate. But yep.
So, what's the reason for this? It's just the ease of use, ability to access these products. Once you make them freely available at a reasonable price and stock prices are good, people start using the products, yeah?
Yeah, I think so. And look, I guess they're all pretty convenient to use. Like, I think that's I guess we're getting used to doing extra applications at marking time, but they're all relatively easy to do. Like the Numbnuts is a classic where it's actually not adding time to what you're doing. You put the ring on and you go bang like that, and you're done. It's a really quick and easy system. I think a contractor said to me the other day it adds a couple seconds per lamb, which is fairly insignificant. I think in terms of an extra procedure. There's another question there that sorry, I was just gonna. There's quite a few there, but do I think there is a need when mulesing for a true preoperatively acting pain relief product that removes the pain of the knife? Look, it's a really good question, but I think trisulfan is very fast acting, and it provides a really good result. Yes, we'd love there to be zero pain, but I actually think what we've got is a very, very good solution, and I'm really comfortable with it as a sheep producer and as a vet. Yes, it could be better, but it's a pretty damn good combination when you provide Medicam and Metacam buccal in combination with a trisulfan instantly.
All right. Hey, there's a couple more questions, and one I think was Susan Finnegan's asked, what do you suggest for merino lambs that are? And I think you might have answered that in questions. Is in the merino lambs that are castrated with a ring, hot knife for tail, and not mules. So that's a ring around the testes, a hot knife, and not mules.
Yep. So I think this is the operation that probably makes it difficult, because you need what would I suggest? And it's difficult because there's 3 different things. No mulesing. Sorry, I didn't realise the no mulesing. So I would suggest. I thought you were mulesing. So for the castration, definitely Numbnuts for the rings on the castration, and I would advise using a Medicam or a buccal to provide us with the pain relief after the gas knife. For the pain relief associated with the gas knife wound. And what we're uncertain about is how well Medicam is, how well trisulfan works in a gas knife wound. So, as I said before, I'm not aware of any evidence that is of use to you. So, that's something that I think further research would be great to know. Is there a benefit in providing trisulfan on a wound like that?
All right, the questions keep coming, and we've still got a few more minutes, so I think we should probably keep taking these. And I think that's a little follow-on from Amy Sluggett. Can Medicam be combined with a hot knife tail docking?
Sorry, I was trying to write a question. Sorry, give me that one again, Pat. Who's that from?
So can Medicam be combined with the hot knife tail docking? So I suppose the question is...
Yes. Yeah, so there's a few people doing this. They're actually putting they're actually putting a ring on essentially, and they're hitting them with Numbnuts, and then they're gas knifing them. So it works, and it's a good option. To me, it just seems slow when you could have put the ring on and be done with it. But absolutely, it actually is an alternative for people that really want to use a gas knife, that they can give the local and then take, because the local, you're going to apply the local, and then when the gas knife comes in, there's good pain relief on board. So yes, that is. Have we got trial work to back it up? No, we don't. But the theory is you've given a essentially an epidural to the bottom of the tail, and then you've chopped the tail off below it. So I'd love to see some data on it at some stage, but yes, I think it's appropriate.
All right. There's a question here from John Northey. I've heard of Medicam being given the day before mealsing. Is this okay?
Yeah, it is. I haven't heard of that, but it would work. It'll be at therapeutic levels. So I mean, I'd say, if possible, do it an hour before rather than the full day, because then you'll have more. Because it cuts out, so we're only going to then get the 24 to 36 hours of pain relief as opposed to the 56 to 72 hours after the surgery is done. But you're still going to have pain relief on board for the most significant part of the pain, which is the first 24 hours afterwards. So yes, it can be. Not sure everyone would appreciate it if I told them they had to catch their lambs twice in 2 days, but it could be done.
All right, Andrew. I think we've basically covered all those off. I suppose unless we get some, I think we've covered off. It's been really good discussion afterwards, and some good questions there from people. I think it's an area which people we're as an industry we're just becoming used to these things, and I think you've probably summarised and put together that whole thing really well. Just a couple of slides, just a quick reminder of the legal things again. From the 1st of July, Victoria, we require mulesing with mandatory in Victoria, so we need to use at least one registered product on them. Ideally, you would use two, as Andrew said, anti-inflammatory plus a local anaesthetic of some form. And the standards and guidelines. Now, we've got to remember that as under LPA, we agree to follow the standards and guidelines, but in Victoria, we still use the sheep model code of practice, which is basically the same. But it's sheep, anything over 6 months, so it's mandatory to require painful procedures like castration or tail docking. Over 6 months, you must use pain relief. And the same in cattle, in the standards and guidelines, unless they're being mustered for the first time up to a year. So on their first yarding, so that's for those extensive northern properties, not something we sort of would accept down this part of the world, but that's the rules under the standards. So we follow those under the LPA, but the actual requirements under the Prevention of Cruelty Animal Act in Victoria, the Sheep Model Code of Practice and the Cattle Model Code of Practice, and that prescribes exactly the same thing. Tail docking and castration should use local anaesthetic or pain relief, or anaesthesia is actually the wording, and Cattle Model Code of Practice is 6 to 8 months for dehorning and castration. I'm not exactly sure why it's 6 to 8 months, but I suppose most people can't tell how the animals are, how old exactly the animals are. I'd like to thank Andrew. I think Andrew's gave a really good talk tonight. It's certainly very practical and full of really quite sensible approaches to what I reckon is quite a complicated area that I think Andrew's explained it quite well. So as you leave tonight, there's a little exit survey to do, and it's important for us to know about how we've done tonight, if we hit the mark. And look, it takes less than a minute to do. There's only 8 questions to answer. So I'm going to say thank you and good night, and we'll sign off there. Thanks, Andrew. Good night, everybody.
No worries. Good night.